Welcome to the Living Donor Educational Presentation. Let's start by reviewing the list of our team members. We have a multidisciplinary team which utilizes staff from different specialties throughout the hospital. There are different types of living donors. You do not need to be a relative to be able to donate. We do on average 15 living donor surgeries per year, and about 3 to 4 of those being humanitarian donors. If you do not match your recipient, we can look at something called a paired exchange. We have 2 different options for paired exchanges. We do an in-center, which is done here locally, or we can do a national exchange, which would involve at least one other center from somewhere in the United States, and that would be the national exchange. Here's a list of blood type compatibilities. This shows who can donate to who based on blood types alone. When we look at living donor matches, we look at blood type, tissue typing, cross-match, along with their medical history and their testing. There are several benefits to living donation. Surgery is scheduled or planned. The kidney has minimal cold time, allowing it to work quicker and hopefully avoid dialysis postoperatively. A deceased donor on average will last anywhere from 5 to 12 years, where a living donor kidney can last 25 to 30 years and longer. It is important that you know that you may stop this process at any time. You have never gone too far in the process to turn back or change your mind. You can let a coordinator know, you can let your independent living donor advocate know, or anyone from the team if you've decided that you don't want to move forward in the process. We can find a medical reason to turn you down so that you do not need to proceed any further. We can also let your recipient know that you are not a candidate. You should have already received the informed consent. Please make sure that you have read and understand this consent. If you have any questions, please let us know. During your evaluation testing, we may find something you were unaware that you had. Some of these can exclude you from donation. We will review your testing with you at your evaluation day. Here's a list of our exclusion criteria. We do what's in the best interest of the donor, even if that means, unfortunately, that we have to turn them down. Please take a minute to review the list of contraindications. Your surgery is called a robotic laparoscopic nephrectomy. You can plan to stay in the hospital 2 days. That does not include your surgery day. Some donors are able to return back to work as early as 2 weeks. If your job is more physical, you may expect to stay off of work for 4 to 6 weeks. The most important thing to do after surgery is to walk. You will have an IV with IV fluids that will continue until you're able to eat and drink. You will have a catheter draining your bladder until the morning after surgery. We will give you a stool softener so that it's easier to go to the bathroom and medications to control your pain. A coordinator will provide you with discharge instructions and important appointments for follow-up. Follow-up is very important for yourself and for the program. The follow-up is time sensitive. When we reach out to you for follow-up, we ask that you please get that done in a timely manner. Your post-operative checks will be done at 2 weeks and 4 weeks, and we'll have you do labs and a urinalysis prior to those appointments. Long-term follow-ups will be done at 6 months, 1 year, and 2 years. These appointments can be arranged locally. They will include blood and urine testing, along with blood pressure and a weight. This picture shows where a new kidney is placed, either on the right or the left side in the pelvis. The recipient's original kidneys, also known as the native kidneys, are not removed. The next few slides are pictures of the robot in a surgery room, and then what a kidney looks like. Thank you for considering organ donation. If at any time during the process you have any questions or concerns, please reach out to your coordinator or a member of the team, and we would be happy to help.